Video's topic is Shunt and Spurt muscle. Let's study introduction, definition, function, examples of shunt and spurt muscles and clinical importance. These are skeletal muscles according to the force of action on the joint and explain dual role, movement and stability. Shunt muscle pulls joint surfaces of both the bones together, acts parallel to the long axis of the bone. Proximal attachment of the muscle lies close to the joint and distal away, causes greater range of joint movement, example brachioradialis at the elbow. Spurt muscle produces rotation of the movement, provides acceleration and acts more perpendicular to bone axis. Proximal attachment lies away from the joint. Distal attachment of the muscle is close to the joint. Example brachialis at the elbow. Clinical importance: helps understand muscle efficiency, rehabilitation planning, sports performance analysis.